Hello and welcome to this theme meeting of the Health and Care Across the Life course theme. I'm Mark Gabay, I'm the academic theme lead, and I have my colleagues here from the public advisor co-leads, Dorcas, Paul, Joe Blair unfortunately can't be with us. She's our new professional lead, and we're still looking to recruit another member organisation co-lead representing the health and social care professions and staff. And I also want to welcome Clarissa and Pallavi, who I think you've all met before, Clarissa being our Senior Research Fellow and Pallavi being our Theme Manager. So just a few quick updates. We've got nearly 70 projects across the theme of various types, including PhDs, internships, projects that are either in scoping or actually started now, others that have submitted grants. We've submitted of 33 of those 69 projects for external funding, and currently 15 of those have been externally funded. There may be more good news next week about that as well. And from this theme so far, there are 36 publications made it to print, and there are 15 more that are either in preparation or already submitted, or over 15. Next slide, please. So we have two PhD students who are going to come to speak to us now. Lauren Fothergill, looking at digital technologies to support independent living in older adults, and Zainab Laheri, who is looking at transitioning to independence, late adolescence access to food and healthcare, and self-management of food allergies. Then we're going to look at our SWOT analysis, that's strengths, needs, opportunities and threats, that we did at our last our quarterly meeting on the 27th of May. Then we're going to have an update on where we're up to with our research development networks that we're hosting. And then we're going to do some more active work looking at the sub-themes, of which there are 6 in this theme. And we're going to put you into breakout rooms. And over the course of the 30 minutes, we'll have a look at all of those sub-themes and get ideas from you about what we should be doing. That's our big ticket projects from within the theme. And then we'll end up with final discussion and questions. So that's enough from me. I think that was my last slide, wasn't it, Pallavi? And so we'll now go into the presentations by our PhD students. Lauren first and then Zainab. Thank you, Pallavi.
Hi everyone, my name is Lauren Fothergill and I'm a first year PhD student at the University of Lancaster, funded by NIHR Applied Research Collaboration. I'm interested in how digital technology can be used to support independent living in older adults. Today, I'm going to talk about my PhD project and how being part of the Applied Research Collaboration will help in this research. So firstly, a bit about me. I have a background in biology where I was first introduced to aging research. I then went on to work in research administration at a university and then completed a public health master's last year. This master's sparked my interest in improving health of populations and reducing health inequalities. This has led me to starting my PhD this year, which focuses on aging research, a crucial area for public health. So my PhD topic is looking at evaluating a digital support system that aims to support independent living in older adults. We know that global populations are aging, which potentially increases the number of people living with ill health and increases demand on health and social care systems. Ensuring people age well is important to reduce illness, improve quality of life in later years, and cut healthcare costs. Living independently is seen as crucial for the promotion of good physical, emotional, and cognitive health. Assistive technologies, such as pendant alarms, have great potential for supporting independent living. However, current interventions achieve modest health benefits. I will be evaluating a digital intervention that is already implemented in the UK called OK Each Day, which provides daily contact services to older adults. I will use mixed methods to assess the effectiveness of OK Each Day on physical and mental health outcomes, such as functional capacity, anxiety, quality of life, loneliness, social isolation, and psychological resilience. The ARC community will be especially valuable for this research, as it will assist and enable the consideration of reducing health inequalities, help disseminate research findings to wider groups, and it also provides an opportunity to engage and network with stakeholders who can input into the research. Thank you.
Hi everyone, my name is Zainab Lahiri and I am an ARC PhD student. I commenced my studies in February and I am based at UCLan. My research project is looking at the transition to independence, so looking at late adolescents' access to food and healthcare and self-management of their food allergies. The theme for my research is health and care across the life course, specifically focusing on the transition to independence from late adolescence to adulthood. I think this is an extremely interesting life stage which is critical with respect to future health status, and there is currently very limited research investigating the period of transition from late adolescence to adulthood in those with food allergies. So the aims of my research: to understand the various factors impacting food choice behaviour in late adolescents with food allergies, to explore their nutritional status, to determine the current healthcare access for late adolescents with food allergies and the barriers and facilitators experienced by healthcare professionals, and finally to co-develop preventive interventions with patients and healthcare practitioners to reduce the negative impacts of health inequity. There will also be a key emphasis on reducing socioeconomic health inequalities throughout my research, and so I will be looking at areas of both high and low deprivation within the Northwest. I will be using a mixed methods approach for my research, so using questionnaires, focus groups, diet analysis, as well as geographical information software mapping. Why the ARC? So networking, to be able to engage with other PhD students, academics, and the wider food allergic community. Training, to be able to further develop as a researcher through the different opportunities that the ARC provides. PPIE, so the involvement of the public and the community is a key aspect of the ARC Northwest, which will allow for my research to be more effective and transparent. And finally, the impact, to ensure that my research is actually readily implemented within the healthcare system to benefit the food allergic community. Thank you.
Hi. So I'll put my video back on. So hi everybody, I hope that was interesting to find out what some of our PhD students in the theme are doing. So let me talk to you about the SWOT analysis that we've been doing. Can you go on to the next slide, please? So what we did, we had, I think, between 40 and 50 people at our quarterly meeting who worked in our 3 breakout rooms. And it's normally called strengths, weaknesses, opportunities and threats, but we're not too keen on the idea of weaknesses. We look at it as needs, which is, I think, a more positive way of looking at it. But as you might know, if you look at the acronym, it's not often used as SNOT. So we looked at, in those groups, what are our strengths, what are our needs, what are opportunities, and what are the threats to the theme. And the reason we're doing this is we think that as hopefully the pandemic is settling down now, and we're moving into a new phase, having got our funding guaranteed now through to 2024, we wanted to have a sort of a bit of a reflection on where the theme has got to so far and what our directions and priorities should be going forward. So that's why we've done that. And if we go to the next slide, please, it can summarize what we found. So I won't bore you by reading through each of these individually. You can do that for yourselves. But a number of strengths were identified, and it's always good to see that there are more strengths and opportunities than needs or threats. Key ones, of course, are engaging and networking and building on the opportunities we have to be able to do that from the wide membership of over 60 members in the ARC, and increasing numbers of public advisors, and they're very skilled and experienced. People, I'm glad to say, thought we were a motivated team, which is always gratifying, and that we listened, which is important. And that what the ARC allowed us to do was to work throughout the life of a project across all of the co-production. That's getting everybody involved. And there were other strengths that were suggested that we had around older adults work that Clarissa is leading, and the marginalized group work. So member engagement is a strength as well as a limitation or a need. And the reason for that is that it's maintaining that enthusiasm that's really important. And also, I think we all recognize that we've only really got going on the sub-themes relatively recently. We need to do more work on that. And that's what today is going to be about. And of course, there's always the issue about people finding time, especially during a pandemic, and finding the funding to enable people to have time to work on these projects. And there's a societal need that was identified there, which is the digital divide. There's an increasing assumptions in the NHS and in social care that everybody has access to the internet. But we know from our research, and there was a presentation, if those are in the person-centered complex care theme earlier, from our own surveys in the past, that we know that around 20% of the people we surveyed don't have regular access at home to the internet. So the number of opportunities there, we've been looking in public involvement earlier about marginalized groups and seldom heard groups and how we get them more involved. The impact of COVID and how important that is, about being proactive rather than reactive. So one of the things that we need to build more of in our theme and what we want to talk about today is at the moment a lot of what we've been doing has been responsive to ideas brought to us from the members and the public. What we now want to do is work actively within the theme, as we have been doing in the older adults group, to identify the projects from within the theme and build small collaborative active groups. They don't need to be that small, but they need to be active and collaborative within the sub-themes to start to write a few big grant applications over the next few months. That was the opportunity that was seen. And obviously with knowledge exchange and getting more people involved in internships. That's been difficult to do, of course, because of the pandemic, and it's been hard for member organisations to free staff time up at in the last 18 months or so. So some of the threats were big, which makes coordination difficult and people finding the time to get involved where they want to. People are concerned about returning to face-to-face work, obviously. The delays that are built in by ensuring that the prioritization system is followed through and that we get the HIAT done, but I don't really apologize for that, because to get co-production right and equity built in takes time, and it's important that we focus on work that's prioritized. And I think another threat is that people sometimes construe, this is mainly academics, that we either do work that we just give people money to go off and do what they want to do, and that's not how we work. And I guess what isn't here but might be thought of is a concern that our member organisations might just want to think that they give us an idea and we go away and do it and give them the answer back, and that again is not how we work. And I think there was a recognition that so far, at least, a lot of what we've been doing has been in the older adult sub-theme, but that hopefully today will help us do that. Next slide, please. So that's a brief summary of, I think, the discussions that we had in May. And what we want you now to do is to comment on that. And Pallavi is going to show you a slide of how you can do that. Because by the end of next week, we'd like your responses to what we've been discussing and what we've summarized there from the discussions last time, so that we can finalize our strengths, needs, opportunities and threats for the next meeting to circulate in advance. Pallavi, can you get us?
Apologies, I'm having some difficulty finding it. Sorry, just 1 minute.
So what we have basically is a virtual whiteboard, which you can go to, and we'll put the link into the chat, and you can go on there and you can comment on each of these items. They've been put on there, and say what your reflections are on what's said, and also an opportunity to add new ones. And that's on there. Pallavi's put that there now, so you can see that you can go onto that virtual whiteboard, split into 4 pages, and you can go on there and add sticky notes and give us your reflections. Okay, so please do that. We do want to hear what you've got to say. It's very important. You don't have to say who you are when you put a sticky note down, but if you want to, you're welcome to. Okay, so we're now going to move on to a brief presentation about the research development networks, which I'm afraid is more of me, but I'll try and keep it brief. So, research development networks, these are how we come together outside of the theme meetings around certain big ticket topics that have been identified at discussions at the ARC, and sometimes from national discussions around what are high priorities both regionally and nationally that we should be looking at in terms of research and implementation. And to date, we've got 3 of these that are being hosted in the in our theme, the Health and Care Across the Life Course theme. And the next slide will show us what they are. So we have 3 themes. Social prescribing, research development network, and for those of you who aren't familiar with social prescribing, it's increasingly seen as an alternative to medication, is that people get their therapy through what's called social prescribing. So that might be exercise, it might be a group meeting, it might be a recreation, it might be meditation outside. There are a number of different ways that people organize social prescribing, support groups, etc. So, and your GP and primary care team can refer you for social prescribing, and each of the primary care networks now have link workers that can help people do that. So it's a non-medication, non-formal therapy, psychological therapy alternative. It might be Citizens Advice Bureau, etc. Another area of our interest, which we've got very active meetings around, is what we've called Seaside Towns and Communities Research Development Network. And that's because it's well recognized around, well, Great Britain, but in England in particular, that the higher likelihood of deprivation and isolation in people living in coastal communities and towns. And so we're trying to look at the public health, the health and well-being of people living there, and if we can develop some big grant applications around that. And then finally, a new one that partly grew out of that, and there'll be lots of interplay because one of our sub-themes in the seaside towns is community mental health, and thinking about as we move out of the initial stages, at least of the COVID pandemic, until it may become part of our everyday life, we are able to look at how we can build on the volunteers that have been working through the pandemic and channel their energies into supporting community mental health and well-being, and maybe making that one of the sort of future focuses of that enthusiasm that people have discovered through the pandemic, and how they want to be able to be more active in their communities and work together more actively. And of course, these research development networks might be hosted by our theme, but as you can see on it's not on the next bit of the slide, they interact with the other themes. So as you can see there, so these are all of the themes feed into these. It's not just ours, but we are the hosts for them. These we'll be posting on our theme pages on the web when these research development network meetings are, and these are open outside the ARC membership as well. So if you are aware of people who have an interest in these topics, who work for a different organization, third sector charity, or members of the public who aren't currently engaged, please do invite them along to these meetings. We'd love to hear their input. What we are planning to do is that each of these research development networks produces 1 or 2 large grant applications in the next 6 months to a year. Some of them have done that already, but we will keep that momentum going. Anybody have any questions they'd like to ask on any of these things so far? Okay, if not, then I'll just move on to the last bit of the talk I want to do, which is to talk about our sub-themes. And as you know, at the last theme meetings, we've discussed what our sub-themes are in Health and Care Across the Life course. And as you might expect, it does follow, for the first 4, the paths that we follow through our lives, if we live through to old age. So families and children is from antenate, so pregnancy, through pregnancy to childbirth and into families, up to the age of the teens, early teens, and then we move through to adolescence, into the early 20s, and working age adults and their health care needs, and then older adults, usually post-retirement. But that can be looked at in different ways. Sort of preparing for older age can start from the 50s, depending on if we're preparing. So for example, we're doing a project at the moment looking at the digital divide and how we want to see if we can enhance people's digital skills from their 50s so that by the time they do retire, they're confident users of the new technologies to enable them to benefit from those as they go into older adults. And then, of course, there's cross-generational. There's two ways to look at that. One is thinking about how we think about the whole life course and from birth to death, and the whole of life, and what are the common issues to think about for health and well-being. But there's also the cross-generational, where we look at projects where we bring together older adults and younger children. So, for example, looking at access to green and blue spaces in coastal areas, in the seaside towns. There's been some discussion and thinking about the opportunities to bring older adults together with school children, looking at their use of the beach for education and recreation, and the coast, and older adults showing younger people what it is that they're used to do, and discovering together what opportunities there are now for recreation and education and healthier living from those opportunities. And then, of course, we talk about marginalized groups, and we're talking about migrants, the homeless, people with addictions, those sorts of groups, and how we can help improve their life and health and well-being through research and implementation. So that's what the sub-themes are about. And what I'm now going to do, and I think we may have more time than we'd originally predicted, which is always a good thing because I've tried to be quite swift, is we're going to go into these breakout rooms, and what will happen is you will stay where you are, but the facilitators will move, and we will be taking it, we will be swapping breakout rooms halfway through. And Pallavi, I think we have a bit more time than we were planning, don't we?
Yes, we do actually. But
so we will add that, I think, add some of that time into the groups, because I think it's important that we get as much discussion as possible going. So what we'll probably do is we will break at the time on the we were originally going to but it will be a bit more than halfway through.
That's fine.
If they can do that for us. So we're now going to get moved into our rooms, and as do we stay where we are, or do we need to click on something, Pallavi?
You will have to click on a button that asks you to join.
Right. And that's true for everybody?
Yes.
Okay,
right.
See you all shortly. Bye. Sorry, I was muted, which wasn't very helpful there. So thank you very much, everybody. So Paul had the Jamboard in our group. I don't know who had the Jamboard in the other group. Was that you, Pallavi?
Yes, I did. Yes.
So do you want to kick off while Paul realizes that what he's going to have to do is present briefly what came up in our discussions?
Okay, can you see that?
Yeah.
Okay, so we had quite a good discussion with both the groups around older adults, cross-generational, and working adults. With respect to older adults, we talked about maybe linking children. So in HACAL, we have a project which is going on, which is called Mouth Care Matters, looking at the oral health of people in care homes. And one of the topics that came up was, can we link children with that particular project? Can we get children involved and maybe even do some training for the older people in terms of just for that interaction between the two sort of generations there?
It might be the other way around, of course. Which is interesting, because one of our providers in our group talked about concerns about what's happened to children and their dental health during the pandemic, and in particular children who were listed for having teeth removed that had got severe caries, severe damage, and that some of them may have dropped out by now, and then where that leaves the dental service with how it has to catch up or what we should be doing differently. So we do have a public health dental team in Liverpool, and the leader of which is also the Deputy National Public, so Chris Whitty's dental equivalent, but in dentistry. So we thought we'd link that up. So that's another opportunity there, maybe to bring those two projects together around oral health and have a discussion about public oral health at older age and younger age.
Yes, taking a note of that. That's quite interesting to know.
Yeah.
A lot of things around digital technology. People who have visual impairment tend not to go out, and it tends to be in older people. They tend not to go out. They have difficulty going out, and they rely a lot on digital technology because of this. And that sort of brings me to talk quickly, just again mention to everyone about the ARC having a digital a healthcare research development network starting up. First meeting is going to be on the 14th of July between 2 and 4. If you're interested, please email me. My email should be in the chat. I'll just put it in again in a bit. Around cross-generational, again, a lot about digital access. Can we help get the younger generation to help the older generation? Again, can we link nurseries and care homes and get the interaction between the two generations there?
So was that a research question or an implementation question? Did people feel that research was there already for that, or
the nursery and care home?
Uh-huh.
I think it was more on an implementation side of things, because I think there has been some research done in this area, if I'm right, and I think it was talking about can we use that more? Can we do that more?
Mm-hmm.
Yeah,
that may be one of those that we talk with Impact to see what evidence there already is around the facilities for that. I know there was a nice TV documentary sort of fly on the wall series, whether there's any research. There seemed to be research that was linked to that project. I don't know whether they've been published or how robust, how strong that research was, but the co-presenters were the academics that were undertaking the project. So it may well be worth looking to see where they're up to with that, and then see if it's an implementation rather than a research.
Yeah.
We're just finishing a systematic review, actually working with some people from Bangor, so that should be helpful about under fives and nurseries. So that will be
great
useful when it's finished.
Thanks. That's Mari Lloyd-Williams. He's a professor in Liverpool, by the way, for those of you who didn't know who that was because you didn't appear on the screen.
Yeah.
Thank you, Mari, and you're going to be working as one of our subgroup leads, so that's great.
Another one
like
was,
you just opted in for the cross-generational one there, Mari.
Another one was effect of COVID on physical activity levels of people. So that's again very cross-generational topic. Just looking at the time, working adults. So I think the story behind this was, I think a while ago there was some sort of I think the way it went was that people would knock on doors to offer support and mental health. However, this is pre-COVID, of course, and not everyone would always be at home, especially working adults. So they wouldn't get the support, coming to their door, if we could say that. Now, obviously, and that kind of changes to some extent because now many people are working from home. So what is the impact on the mental health and physical? So it's like different between pre-COVID and post-COVID on mental health and physical health. And people with caring responsibilities who are working, they have the caring responsibilities as an impact on finance.
Yeah, so just to pick up that one about work and health, because that's one of the areas that I've done a fair bit of research in the past or so, but the research on what employers can do to improve the health of their workforce is quite mixed in its quality and what we call generalizability. So whether it's relevant for lots of workplaces, but of course now we have a different type of workforce potentially who may be almost entirely working at home or partly working at home, partly in the workplace. I think there may be some really interesting questions about to what extent, what evidence we do have about keeping people fit and healthy through workplace initiatives that can be extended to people who are in the workplace, but their workplace is now their own home. So going for a lunchtime walk with your workmates doesn't really work if you're sat at home. But those are the sorts of things that internationally have been introduced, that staff have a walking lunch, for example, or go to a sports activity at the end of work. I don't know how much time we have left, Pallavi.
We have a few minutes, but I think Paul can just quickly take us through what you guys did,
please,
in the other session.
Yes, just share the screen there. Hope that's clear. So yeah, probably concentrated more on the kind of left hand side there with families and children. I think Naheed brought up a couple of points around education and the impact that education's had on all generations, but especially kids that are kind of moving in between schools. And then kind of Mark was making a point around there's more around anxiety there as well. Maybe if somebody's got a real ambition and a really good kind of educational and career pathway, you know, that's going to be hit heavily due to the lack of exams, or the lack of kind of thoughts about the exams, maybe when people are going for jobs and that kind of stuff. So that was a big one that came up. We covered about kind of sure start centres, and Jerry came up with a few pieces here about sure start centres and the things that have kind of have happened with that over the last few years. Highlighted a project around building bonds, or an initiative around building bonds that's currently being promoted by the CCGs and delivered by third sector organisations. So that's maybe a theme that we can look into a little bit further. In that kind of adolescence group, Selena, you know, I think you spoke, and I think I spoke in the previous meeting, just about some of that work that we had in our Seldom Heard Voices around kind of youth that happened a couple of weeks ago, specifically around children in care and kind of the impacts that isolation and being away from the families and not being able to kind of go back to the families of a weekend and that kind of stuff has had on those children, and they feel as though they have been kind of quite isolated. And there was a couple of people mentioned a project that Mark was thinking about, the PAIRS project, where we were kind of looking to signpost young people to other people or organisations or families for support that's happened previously, and maybe kind of, you know, we could look into how do you implement some of the things that came out of that PAIRS project in future. And then probably a theme that came right the way through is bringing people who are going through these issues to talk to us themselves. So, you know, young people, you know, they're the people who we need to listen to, and you know, those questions, they might be having questions or having issues that we would never even think about. So bringing up kind of some young people to talk to us and get involved in some of these groups, I think, is probably vital. And then probably towards the end of the session there, we were discussing kind of domestic violence among families. Obviously, it's been a big issue kind of through the pandemic, with people being enclosed into a kind of small environment. But, you know, definitely kind of, you know, an increase in that seen over the last couple of months. And also, you know, support being given to refugees who can be seen as marginalised groups or vulnerable. That's certainly something that's being highlighted. You know, we've been able to give support to those kind of groups before, but since the pandemic, maybe because of funding issues or just because of resources, those groups have been pushed to one side. So it's kind of identifying how are those groups feeling now, and are they even more vulnerable and marginalised after pandemic, before pandemic. So I think that was an overview, Mark.
Yeah, thanks very much, Paul. It just reminded me of talking about the domestic violence, as we just had in our practice, we just had an education session around safeguarding and domestic violence, and maybe that's a potential question there, is the extent to which safeguarding training for health and social care services does actually enable us to get more people into support services, or indeed has the opposite effect, that people are frightened of attending in case or in case they're being held back or feeling scared of the consequences of engaging with services because of what's been happening during isolation. So some great ideas there, lots to work on, and we're always on the lookout for ideas and plans. So please do keep in touch, and we will be summarising some of those ideas and some of the things that we can link that to, and we'll be getting back in contact with you about those elements in the sub-themes and what's going on, and then asking people to volunteer to join as many groups as they feel comfortable in joining, and of course they will remain open groups, but there may be some people who want to say, I'd like to be core part of that sub-theme, please, and involved in developing the work plans going forwards. And I will continue to harass the academics who, for various reasons, we don't have so many of today, and get them to engage with us. They're the relatively underrepresented group today. Okay, so I think we're just coming to the end, aren't we? It's lunchtime now, Pallavi. So
That's right, yes.
Are we supposed to go to me saying thank you very much and see you at lunchtime, or have we missed that?
Go for it.
Have you got that presentation?
No, there's no presentation.
Just for me to say, I thought I'd
You just
recorded that
say
one
it.
as well. So,
No.
right, so we're starting at 1:45, is that right? Or is
It's
it 1:30?
It's 1:30.
1:30. So I'll see you all at 1:30. Go off and enjoy lunch if you're going to have any. It's not Ramadan, so presumably somebody's having something. And see you in 28 minutes. Okay, bye.
See you. Bye. Thanks for attending.